Hi, I'm Erin Shanefelder Gonzalez. I'm a psychologist with the Pearl Clinic at Seattle Children's Hospital Outpatient Psychiatry. And today I want to answer the question, what kinds of therapies are effective for helping kids with ADHD or disruptive behavior? So often parents want to know what kinds of therapies they should be looking into for their child who's having some behavioral issues. We know that there are medications out there, but there are also some therapy options that can be really helpful. Usually, when we think of therapy, we think of a child sitting on a couch with a therapist talking about their feelings, maybe making goals together, talking about how they're going to be successful in school or with friends or at home. But the research really shows that that one-on-one type of counseling or therapy isn't very effective in changing kids' attention and focus, changing their school performance, or changing their ability to control themselves and stay on task. Individual therapy can be helpful, especially for things like anxiety or kids going through a major transition or a change. But when it comes to behavior, what we find is that one-on-one setting is just not enough like real life to help kids develop skills that are going to be useful for them in the real world. Instead, what we find is that we can work with caregivers for that child. And that's usually parents, sometimes teachers or other people in the child's life. And we can help equip those adults to be in kind of a coach role for the child. Because if you're the parent of a child with disruptive behavior or ADHD, you're going to be spending many, many hours with that child every week. So your child is going to get a lot of intervention from you versus 1 hour a week or maybe less from a psychologist or another professional. So we call this type of training parent behavior management training. And what it involves is working with a mental health specialist, like a psychologist, to learn some different tweaks on parenting strategies that are going to help your child be more successful in meeting expectations, being independent, and respecting limits. So this is a type of therapy where the parent is going to come in without the child most of the time. There may be some sessions where the child comes in with the parent, but mostly it's going to be just for parents. And often these treatments are done as a parent group. We actually think it can be more successful and fun and engaging to do this as a group because parents really can learn from each other and try out different things and support each other in the whole process. So each week, when you come to group or you meet with your therapist is going to ask you to try some things out at home. They're going to introduce a new skill, ask you to try it with your child, and then come back the following week to report on how it did and tweak and troubleshoot together. That sometimes might involve role playing a situation that did or didn't go well and figuring out some different ways to do it. And the types of skills you'll be learning are, first of all, how to engage with your child in a really special, positive way to build up credits in your relationship with your child. We want to start with positive because later you're going to be setting limits and introducing even punishments. And we want to have lots of positive ground to build up on before you introduce things that your child might find to be a little more negative. So we'll start with positive relationship, and then we'll talk about ways of increasing positive behaviors. So some might be things your child already does well already, but also building and shaping skills from small positive behaviors, like maybe your child gets themselves dressed, but doesn't finish the rest of the morning routine. We want to build on that from one behavior to a series of behaviors and use praise, use rewards, use positivity and different ways of keeping your child's attention to help them complete routines more independently. We want to learn how to take our attention away from a negative behavior that's designed to get a reaction out of us. That tug of war we sometimes get in with our kids where they're looking for a reaction and we're trying to set a limit and redirect them. We'll look for some ways to deal with those kind of attention-seeking behaviors. And then we'll also talk about limit setting in the home, how to create structure for your child. You may have a child who needs more structure and more limits than some other children might, and how to put consequences into place to deal with behaviors that really aren't acceptable in your home. Another important part of these programs are to think about other settings where your child may need some support. So we often talk about bridging into the classroom how to work together with your teacher to set up a plan to increase positive behavior and set limits on negative behavior, and just put more structure into place for your child. We might also talk about extracurricular activities or social situations where your child needs more help. So the goal is, this is not a therapy that goes on forever. You've got certain things you're going to work on. We call them target behaviors, things you really want to see improve. And you may meet with your specialist from anywhere from a very brief 4-session program up to a more comprehensive 16, 18-week program. But most of these parent behavior management training programs fall somewhere in the middle. And at the end, our hope is that you're set up to carry those skills forward and apply them to anything new that comes up, a new situation, a new behavior, and be ready to use them independently. Although booster sessions can be helpful as well.